Good evening, all. Members of the committee, please turn on your camera and confirm your audio is working before we go live. Yeah?
Yes.
Good.
Yes.
Okay.
Yes.
All right. Thank you very much. Good evening and welcome to this Adult Social Care and Health Select Committee meeting. I am Councillor Marwan El Naji, the Select Committee Chair. This meeting is being held in accordance with the recent government regulations on holding virtual meetings. Please bear with us if we run into some technical challenges during this meeting as we adapt to these new working environment. In line with government guidance that everyone should stay at home as much as possible, this meeting is being held via Microsoft Teams live conferencing, and all the committee members, council officers, and the parties who wish to participate in this hearing are joining us from remote locations. The event is also being streamed live, and members of the public and the media are welcome to follow the meeting remotely and listen to the discussions taking place. I would like to welcome any first viewers, listeners to this Adult Social Care and Health Select Committee. Please may I remind you that this month marks the 3rd anniversary of the fire at Grenfell Tower, where 72 of our residents tragically lost their lives. At this special time, I ask every member of the committee to pay our deepest and continuing respects in the conventional manner by marking the moment with 72-second silence starting now.
Chair, the 72 seconds has elapsed.
Thank you very much, and now we can start the meeting. Please may I ask all members of the community to only unmute their microphone when they are addressing the meeting. Otherwise, we run into technical problems. And this is to save bandwidth. I would ask councillors only switch on their camera when speaking and remember to switch them off after having spoken. If a councillor wishes to speak on a particular item and has not been called to speak, please indicate by typing the clear letter Q in the conversation column or using the hands up feature in their Microsoft Teams. To assist your fellow councillors, officers, and members of the public watching online to identify you, please state your name before you speak. If for any reason your connection drops out or you miss something, please can you let me know as soon as possible. And finally, in the event that my connection drops, I nominate Vice Chancellor, Councillor Max Chauhan, to take over the meeting. I confirm as a chair that I have no declaration of interest to make regarding any of the items on the agenda. I now call for the councillors to declare any interest in their presence for this meeting, please. Members of the committee. So I call Councillor Max Chauhan.
Hello.
Thank you. Councillor Wala Idris. Councillor Laura Round. Thank you. Councillor Laura Round, she sent her apology.
Apologies for lateness, Chair. She will be with us later.
Okay. Councillor Malcolm Spalding.
I'm here,
Councillor Spalding. Good evening.
Good evening, President.
Councillor Portia Thaxter.
Hey,
As I
Chair.
said, oh, well, good.
Thank you.
Present, Chair.
Hi, good evening, Councillor. And Councillor Charles Williams.
Present, Chairman, and no interest to declare.
Thank you. And our co-opted members, Christina Vigars.
Nothing to declare.
Thank you very much. Now, I move to item A1, membership and chairs and vice chairs. I would ask the committee to note the membership and the chair, vice chair, as agreed at the annual meeting of the Council of the 20th of May. This item is noted, yeah?
Yep.
Noted.
Okay, item 2, apologies for absence. And this is the apology noted as stated by our officer. Now, shall I move to item 4, A4?
Yes, please.
All right. So this item is the minutes of the meeting held on the 18th of March, 2020. The minutes of the meeting have been circulated. Is it your wish that they are being signed off as a correct record for that meeting?
Yes.
Agreed.
Agreed.
All councillors agree?
Agreed, yes.
Yes.
Thank you very much. So that's noted as agreed. Now I move to item 5. In this, I would like to welcome Professor Danai Manika, who is a professor of marketing and business education at Brunel University, London, who is here to talk to us about her research that she has conducted on linking healthcare and environmental sustainability. I have invited Professor Manika to bring her research ideas and results to the select committee, as it is good scrutiny practice to hear from different voices and stakeholders. Her research could be useful to help us think creatively and scrutinize how residents' needs are best met and how social care services are provided for after COVID-19 pandemic. This can help us scrutinize better the council responses and help us in setting the recovery strategy. May I ask Professor Manika, please, to present her research?
Hello, Chair. Hello, everyone. Thank you very much for inviting me. Today, I'm going to talk about linking environmental sustainability and healthcare, and specifically, I would like to introduce to you an energy-saving intervention and its potential benefits for healthcare settings. So, first of all, I will show you what an energy-saving intervention looks like, and I'm going to present to you a real energy-saving intervention called Operation TLC. I will talk about the potential benefits of such interventions, for example, for hospital patients, hospital employees, the hospital itself, as well as the environment. And then I'm going to open up the discussion about how these types of interventions can actually benefit other healthcare settings, as well as the Council. I would like to declare that this work was actually funded by Queen Mary University of London. It provided me with an opportunity to carry out a secondment to Global Action Plan, which is an environmental charity based in London. And with them, we worked together based on the research that I will present to you here today. If you would like to know more about this particular research and the findings, you can actually access the whole study, which is open access, available via this link. So first of all, I would like to start by saying that multiple sectors are engaged in sustainability. However, we have seen that one size does not fit all in terms of different practices. And what one may work for one industry, it is not certain to work in another. Particularly healthcare is a business unlike other businesses, but sustainability choices could be affected by its unique features. So, for example, such as service orientation, its status as public and social good, and its environment with distinctive features such as room layouts, sound level, lighting, and temperature. Energy saving schemes within healthcare have so far focused on technical solutions, such as, for example, low watt light bulbs, retrofit insulation, double glazing windows, and improving heating controls, amongst others, to reduce energy consumption in buildings and associated costs. However, these type of energy saving schemes that have been focused on technical solutions, they have also been found to have potential negative consequences for patient care provision. So, for example, they might result in delays in terms of operations, additional costs, as well as disruptions associated with, in essence, new infrastructure. And that's why a lot of the times healthcare managers are very reluctant to implement them, because not only they don't trust their effectiveness, but there's a huge uncertainty in terms of the impact and the reputation of these interventions for these type of organizations. And hence what we try to do is we try to really focus on a novel approach to actually look at how to motivate employee energy saving actions within, for example, hospitals, and try to see if these type of behavioral interventions could actually have potential benefits, not only for the hospitals and also for the environment, but also additional benefits for various stakeholders. So what we did is we looked at Operation TLC, which is an environmental energy saving intervention that has, in essence, been designed by Global Action Plan. My apologies, I have lost control of the presentation. Can I continue?
Yes, continue, please, verbally. We could distribute the presentation, the slide to the committee now, no problem.
Of course. So particularly Operation TLC, it's an energy saving intervention, real intervention that was designed by charity Global Action Plan, and it particularly encouraged energy saving actions among hospital employees, such as, for example, turning off machines, lights out when not needed, and closing doors when possible. You can see them right here. So So within hospitals, lighting usage accounts for the largest percentage of energy consumption, followed by the use of medical equipment, and in the NHS specifically, 22% of CO2 emissions are a result of energy usage in buildings. Thus, energy-saving actions such as, for example, turning off machines, lights out when not in use, and closing doors to stabilize temperature in a healthcare setting can actually reduce carbon footprint and associated cost with, in essence, energy consumption. It was also considered that these type of actions could easily be carried out by employees and would imply minimal interference with medical treatments and hospital requirements. The intervention was delivered via multiple communication platforms. Face-to-face discussions took place in the hospitals with employees using electronic tablets as props to help hospital employees become more familiar with, in essence, energy-saving actions. We had posters and also stickers were placed on doors through the hospital, and pen and paper and t-shirts were actually distributed as reminders of energy-saving actions. Besides being part of the same organization, the two hospitals that in essence this intervention took place in, it also allowed us to regulate aspects of the NHS hospitals' daily operations and infrastructures. So both of the hospitals, they received the same TLC intervention. They were both located in London, and each hospital had in essence a minimum of 6 buildings, a capacity for more than 300 beds, as well as had an accident and emergency unit. So they had quite kind of similar features in terms of kind of the features of the different hospitals. Due to these similarities, we treated these two hospitals as, in essence, one organization. Now, aside from the direct benefits of energy-saving behavior change for the hospitals, we were also able to see that such interventions encouraging these kind of TLC energy-saving actions among hospitals employees, they could also directly benefit employees themselves while they're engaging in these actions. Also, they were indirectly benefiting patients. So particularly our results, what do they show? They show that there are benefits for multiple stakeholders. So first of all, hospital employees did actually report greater level of work efficiency due to kind of increased quiet time periods. So they felt happier and they were able to, in essence, work more efficiently. But also we monitored the fact that hospital patients were also indirectly pretty much affected by these kind of TLC actions that were carried out by employees. They reported quality of sleep improvement, and also that was positively associated with a greater hospital experience and satisfaction overall. So we can see that these energy-saving actions could also benefit hospital patients. And of course, as an energy-saving intervention, it also resulted in kind of lower kilowatt per hour consumption. And this was also good not only for the costs associated with hospitals, but also for the environment in terms of reduced CO2 emissions. So these were, in essence, the multiple benefits for various stakeholders based on this energy-saving intervention. Now, how does this type of intervention apply to other healthcare settings? There's definitely some room for improvement in terms of looking how these kind of interventions could actually benefit care home settings, especially because there isn't so much research and kind of practice in terms of how we can encourage energy saving within care home settings. And this can also contribute to the UK's carbon reduction kind of targets. But also we know because COVID-19 had, in essence, significant impacts on the care home sector, we could also be looking to see how these type of energy-saving intervention could also become part of the greater kind of recovery strategy for COVID-19 in terms of the care home sector. Now, another kind of opportunity that we could look at is the fact how these type of interventions could actually benefit residents of the borough, but also employees that are working within the borough. So, for example, we have seen there are linkages between health and pro-environmental behavior change. They're interconnected and they can provide, in essence, an approach to a holistic type of well-being. Specifically, I've done some research that was funded by Cancer Research UK that actually looked at this kind of linkage between environmental behavior and health. And particularly that study looked at how recycling and energy saving behavior can also increase kind of physical activity in terms of step counts. So if you think about it, if you're not taking the elevator to save energy and you're taking the stairs, you're increasing step count, good for your health. So there is this link, and we could explore how energy-saving initiatives and more pro-environmental kind of behavior change initiatives within the borough could actually help health and well-being among residents. And of course, this could also serve as kind of an additional type of involvement and participation on behalf of the residents and interactions with the council as well as between residents themselves. So this was just kind of an opening introduction of my research that I hope that you find interesting, that can open up kind of future avenues for discussion on how these type of interventions can actually benefit the borough residents and more specifically adult social care and health. So thank you very much. This is my presentation. I would like to open it up for any questions that you might have. And thank you again for inviting me to this meeting. Thank you very much.
Thank you so much, Professor Maika, on this very interesting piece of research in different contexts. And I'm really grateful to your time at such short notice to participate with us in this strange environment now we are facing. But yeah, thanks again for your input. You are welcome to stay, of course, after the question and answers. But now I open it to the committee members. Please, if you have any questions about this introductory piece of research in the context of environmental sustainability, energy saving, and in the health context, and how this can alter behavior, and how this we can benefit from such a piece of collaboration. So, any councillor, please, on the committee would like to ask a question? Please raise your voice. I can't see members. Councillor Chauhan?
Hello, yes, I'm trying to get the dialogue box up, but I put my hand up, so I'm glad you've seen that.
Yes, very kind, because I can't see the chat myself. So, yeah, okay. Thank you.
Yeah, no worries. So I thought, I'm glad I got your attention. I just have a quick question on slide 5, where you talk about the benefits for stakeholders. And I just wanted to just understand about the hospital patients bar in the middle and how indirectly employee TLC actions improve patient experience and satisfaction.
Yes, of course. Thank you very much, Councillor Chan, for the question. So in terms of hospital patients, obviously the intervention was targeting employees of the hospital. So they were, in essence, the direct target of, let's say, the intervention. So whatever effects we see on hospital patients, they are, in essence, indirectly derived from, in essence, this intervention for hospital employees. We particularly looked at the hospital patients' kind of benefits via different surveys that we did. And what we were able to see is that there were significant improvements in their kind of reported quality of sleep as patients. And also we saw that that was also positively associated with kind of a better hospital experience. So hospital experience satisfaction was not significantly different before and after the intervention, but it was positively related with the quality of sleep, where we saw significant changes before and after the intervention. Does that answer your question? Or would you like me to
does.
More?
I was just thinking, switching off lights clearly on the wards helps patient experience, and I was wondering how you captured that data. But that's fine. Thank you very much.
Thank you.
Pleasure.
Any other member, please? Do you have any questions? Any comment? please speak up because I cannot see the chat box somehow. I don't know why. So just let me know. State your name if you want to ask a question. If no more questions, now I turn it to, do we have anyone from other than the committee members to ask question, please? Councillor Pat Mason, please.
Right. Good evening, Professor. Very interesting talk. We can see during the ongoing COVID pandemic that there are probably what we would call significant sections of the population who don't change their behaviour. They're crowding into parks and beaches and all the rest of it, even although people like me say, what do you not understand about 60,000 people dying? So how did you, or how do you motivate hundreds of nurses and doctors and hospital staff, or how, if you've done it, how did you how did you get them to participate? How did you motivate them for enough of them to participate for you to carry out your study? How did you motivate them, or were they marvelously self-motivated already? How did that work?
Yes, of course. Thank you very much, Councillor Mason. Particularly in terms of motivating behavior, it is really hard in the beginning of any type of intervention to motivate the initial kind of action. And this could be about pro-environmental behavior change, but it could also be about health behavior change, for example, related to COVID-19. So I think in the beginning, it's all about, first of all, raising awareness about the benefits of how these type of actions could actually benefit the employees, the hospital, but also potentially the patients. So we need increased kind of awareness of a phenomenon and its benefits. Then the next stage, what it is that the targets, or specifically the employees in this case, they started contemplating about the idea, but may not have actually taken action to do something. At that stage, it's up to us as, in essence, the intervention people to actually try to remind them that these type of actions, they wouldn't actually stop their busy work. Because of course, nurses and doctors, they're super busy within the hospitals. They always do something, they always run around. They don't even have the time to kind of stop. So that's why it was very important for us to make these actions very super easy to do, and to also place reminders around the hospital that could actually remind the employees to engage in these type of actions. And that's why we had, for example, stickers and posters all around the hospitals. We also had T-shirts. We also had kind of games and competitions where, for example, nurses could, compete with each other in terms of who does the most. And again, the competition was based on kind of them engaging also with the different energy-saving actions. So these type of kind of tactics, they're used to, first of all, motivate action at one point in time. After that, in terms of kind of changing behavior, we need to ensure that this becomes kind of a habit. And I think that's the most kind of difficult thing. And I think we saw that with COVID-19 as well. In the beginning, people were more kind of accepting of the rules, and they were trying to be good and stay home. But after a while, this kind of habit didn't actually continue. So again, it is up to us to identify different triggers that could actually form this kind of habit forming type of behavior. And of course, these triggers can differ between pro-environmental behavior change and health-related behavior change, as well as between different types of health behavior. I think overall, the message that we communicate needs to be very simple so that people actually can follow. So for example, stay indoors was a very clear message in terms of COVID-19. But also, we need to also take into account what individuals think in terms of what part of the knowledge applies to the self. So I've done some additional research in relation to kind of the H1N1 flu. So not COVID-19, but back in 2009. And what I found is that it's not knowledge that triggers behavior change. It's more what knowledge, what part of that knowledge, that awareness, individuals think that it applies to the self. So in other words, if, for example, let's say that I hear about what I need to do in terms of protecting myself for COVID-19, first of all, I need to understand it. Then I need to retain that information in my long-term memory. Then I also need to kind of recall it and think that this is relevant to myself. And then the behavior has to be easy enough that I can do it during multiple times.
If I could have one supplementary, Chair, is that possible? I can't hear you, Chair. Have you got to the stage of talking to the National Health Executive or the government about this? Because of course it will only really work if it's across the entire sector, and of course care homes as well, and so on, every sector. Have you got any? Have they given you any view of what they think about this? Because they'll have to implement it if it's going to work at all. It's a useful idea, but it won't work unless they buy into it.
Yes, I completely agree on this with you 100%. So in terms of this particular study that was conducted in 2 NHS Trust hospitals, the report actually did go to the Department of Health via Global Action Plan. Again, this is something that I worked as an academic while I was seconded to Global Action Plan, which was the charity that in essence was in charge of the development of the intervention and conducting, in essence, the study. So I was only able to provide kind of consultancy type of services and write up the report and the results. So definitely they did report this to the Department of Health, and I know that they were interested in the findings. But since then, we haven't had a discussion in terms of how we could do this type of work within a care home setting. But I have actually talked to Councillor El-Nagi to talk about how potentially we could try to pilot test it within care homes, because of course hospitals, they're not the same exact settings as a care home. So we really need to first do a small pilot test before we can actually carry it kind of across the UK. So I think that would be an amazing opportunity, and I would welcome your views on how we could actually do this.
Well, thank you for your talk, Professor, and thank you, Chair.
Thank you so much, Councillor Mason, for this follow-up question as well. Any other question, please? Do we have anything from the public, Gareth, or other councillors who would like to participate before we move on to the next item? No? Okay. So thank you so much, Professor Monica, on this very enlightening talk. I hope with this will be an opening for further collaboration with academics like you from Brunel, the UCL, Imperial, Queen Mary, since you have a good link. So thank you so much again for your time. You are welcome to stay, and we look forward to welcome you in RBKC here. So thank you so much again, and good evening to you. And you're welcome to stay, of course.
Thank you.
Thank you. Now we move on to the next item on the agenda. Item A6 is a COVID-19 update. As you know, COVID-19 health emergency had a serious impact on the health and well-being of our residents. And the Council has responded to the best of its ability with the government's guideline to address COVID-19 pandemic, from the outbreak management to shaping the recovery. Scrutiny has an important role looking at Council responses to any crisis and its recovery strategy. Decisions made by the Council will certainly impact on our residents and the places they live, and scrutiny will enable the Council to draw on a broad range of perspectives as we've seen tonight. So on behalf of the committee, first, I would like to express our deepest condolences to each and every member of our Kensington and Chelsea community and the wider community who have lost family members, neighbors, friends, or colleagues to this coronavirus pandemic. May I now ask Huda Al-Sharif, she is our Interim Director for Public Health, and Gareth Wall, the Baybara Director for Integrated Commissioning, to introduce the report. Thank you. I have one second, please. Councillor Idris, you have a question.
Good evening, everyone. I would like to add my voice to offering my condolences to families and friends of those who lost their life for the pandemic. I have actually more than one question. Can I ask them back to back, or do we need to alternate?
After the presentation, you can ask a question, yes?
Okay, well, I'll wait. I wait for the presentation then.
Thank you, Councillor Idris. Yeah, and I can see another hand. Please speak up. I can see a hand up, but I don't know. I cannot identify it. Sorry. Anyone else want to speak?
It's Councillor Healy, Chair.
Councillor Healy, yes.
I wanted to ask, this is a very important issue, and of course we must discuss it, but I raised with you earlier today an equally important issue, the future of the Royal Brompton Hospital.
We are coming to this one, Councillor Healy, later.
I'm simply asking if we will be able to discuss it tonight.
I don't think we are able to discuss it. Let's see the agenda items first, but it is on our work program to find out fully what's happening. So we can ask, after the report, we can ask clarification of where we are on the Royal Brompton Hospital after this item, if you can allow this.
Thank you.
Councillor Healy. Yeah. Thank you so much, Councillor Healy. So may I have the presentation now, please?
Good evening. I understand, Chair, that you would like half a minute introduction to the report, and it's a double act between myself and Gareth. So this report outlines the Council's response to COVID-19, mainly from a public health and adult social care perspective, including how we are supporting the government to manage outbreaks and responding to COVID-19 based health inequalities. The Council responsibilities cover, among other things, support for those who are shielding and vulnerable, and to mitigate the impact on all residents as well. So the report focuses on the test and trace program, which is about identifying now that we are moving out of lockdown, identifying those who are positive and making sure their contacts are traced and advised what to do, and also to manage outbreaks should they occur. We published on Tuesday our outbreak control plans, and they're available on the Council's website. And we are working across the whole Council with colleagues from the CCG as well, and also vertically with Public Health England and across London. And just want to say we always follow national guidance in every step we are taking. So we're based on the most up-to-date evidence and guidance. The report also contains some highlights about the impact, the disparities of COVID-19, both in terms of risk and in terms of outcomes for people, various people. There's a heavy focus on Black and ethnic minorities, but also on other protected characteristics like age and disability. So this is really the essence of the report. Obviously, you have the detail, and if I could pass to Gareth now.
Thank you very much, Huda. Thank you, Chair and members. The second part of the report, from sections 7 through 10, detail some of the measures that have been taken by colleagues in adult social services in order to provide support to providers across the social care market. It starts with setting out the nature of support that's been provided, in particular to care homes, which has been centred around really close relationships between staff in the Borough with each of the care homes, with at least daily telephone calls to key people in each of those homes, particularly the care home managers, to make sure that they know how to access our support, know how to make arrangements for the receipt of PPE, and could receive appropriate advice around infection control measures, which has also been supported by colleagues in the NHS. Furthermore, we have also made available access to additional funding and support as and when that has been required by those providers, using the grant money that has been made available to local authorities and the specific infection control money that has been effectively passported to care homes through local authorities. But I would emphasise the really key thing I think that has worked so well in terms of support is developing what was already a kind of a well-established relationship with those care home providers through the daily support calls, and they are very comfortable now in their position of being able to call us and whenever anything is required. Moving on to section 10, that provides detail about the other key bit of the social care market for us during this crisis, which has been domiciliary care or home care. And similarly, we have had ongoing daily support to both the key contracted home care providers across the patches, as well as any spot purchase arrangements that are available. And we have had an offer similar for home care as we have to care homes, which have included making sure that we maintain stability in the market, particularly where some of those care providers will have seen temporary losses of some of their own staff who needed to isolate during the period. And so in order to maintain that stability, we were paying on plan, so what was expected. And it was also important to pay on plan, not just because of staff who might need to isolate, but because a number of service users may have temporarily suspended their package of support for home care because family were at home and able to support them wherever they would usually be at work. And also because some people had concern about different care workers potentially coming into their home cross-infection. So we've continued to pay those providers in order to shore up and support the market. We've made sure that those payments were swift, and we've also had some special availability of payments through the reimbursement of transport requirements for some of those staff, recruitment bonuses to make sure that additional staff could be brought into the sector as needed, and as with care homes, providing access to PPE supplies. So that's a quick run through of the nature of support that we've been providing to the market, and I would extend real kind of thanks to the staff across the team who've been doing that on a daily basis, 7 days a week, being available to provide support. And I'm happy to take any questions. Thank you.
Where am I on this?
Chair? Have we lost Chair?
Hello?
Hello?
It certainly sounds like it.
Have we lost the Chair? Max, you want to jump
I can't hear
in?
him either. This is Councillor Round. I can't hear him either.
Hello? Shall I ask my question? Anyways. And keep it going until he can. Oh, there you are. Oh, hello. We lost you.
Is Marwan back?
Oh no, yeah, Marwan, we can't hear you, Marwan. Unmute.
Okay.
We can't hear you.
I guess.
We can't hear you.
Hello? Can you hear me now?
Yeah, we can. Thank you.
Okay, you're back, Marwan.
This is an overriding system. It's a new headphone. Idris, and thanks so much, Huda, for your introduction paper. I thanked you, but I assume you did not hear me. So thank you.
Okay. Thank you, Chair. I have a couple of questions. My first one is on it's actually on 3.3, where it says the core of the system relies on self-reporting.
Yes, by the public. Yeah.
By the public, yeah. Is there, have you deducted any cases where people are not reporting themselves, having maybe symptoms but not reporting? And shall I ask all my questions and then you can answer them back to back?
I think so is better.
Okay.
Yeah, so they can be prepared.
Okay, and then my second question is 9.3, where it says in line with Public Health England guidance. My question is, how many of those people have we had so far coming forward? And my third question, apologies, so many questions, is on the following page under 10.3 is the third point, where paying carers £5 per day for parking, but now we are actually parking attendants now are ticketing people who are parking. So we have, I'm assuming we have some kind of means of safeguarding them or some kind of temporary permits or whatnot. And my absolute final question is the following point, which is recruitment bonuses and recruitment via online. I was wondering if you met with any issues and how, because you're recruiting for people to care for very vulnerable people. And my concern is I am one of those people that I like to see people, and I think I get a better feeling about the person when I see them as opposed to hear their voice on a phone or maybe see them behind a screen. Have you encountered any issues, or is that all covered by the DBS? Thank you. Thank you very much, Chair, and thank you, everyone.
Okay, thank you so much, Councillor Idris, for all the compact question. Who is going to take it on?
Chair, if I respond to the first question, and I think the others are.
Please.
So in terms of people not reporting, we do not get this information, and I will be surprised if there were people who, if there were not people who were not reporting. And yeah, it's more about encouraging people. It's all the communication we're doing to encouraging people to take action so they can protect their loved ones and people around them. And any intelligence from the community about how you're feeling, how you're seeing, what you're seeing around you, then we really would love to hear, so we can maybe target messages and be out there and speak to people.
Thank you, Huda. And the other questions will be taken by Gareth?
Yes, I can take those. Thank you for those questions, Councillor. So 9.3 in relation to following public health guidance around considering as an outbreak care homes where 2 or more people have COVID symptoms. There have been some incidences of those. I don't have the exact numbers, but I could get them for you and share them afterwards. I would give reassurance, though, that in the majority of instances that was very early on in the outbreak, and it's been quite a while now since we've had an incidence where there have been 2 people who are symptomatic within a home, and that is still monitored on a daily basis, and it's been some weeks now since we've been in that position, but I can provide the numbers for you separately. In your other questions, in relation to the reimbursement for carers using a car at £5 a day, you make the point that there have been examples of people being fined for parking violations, but as those regulations have changed again now, we haven't had any incidences of care staff reporting to us that they have received such a fine, but we have been passing on to care homes that amount of money in order to provide support for a parking ticket where people want to pay to park, but we haven't had a fine to date. And then your last question around the use of recruitment bonuses and online recruitment, I sympathise. I joined the by-boroughs myself during this period, so it's been a kind of odd time to do it. But yours, more seriously, your point about getting a feel for people by meeting them in person rather than doing that online. That the reason for providing that bonus was largely to provide cover during a period of a fortnight when some staff might have had to isolate. And my understanding is that those types of recruitment would have been done through bank staff or people that would largely have been known or have been used before by those agencies, rather than recruiting cold people who they haven't worked with before or with whom they would have no reference. So there is a degree of reassurance about it too.
Lovely. Thank you so much, Gareth.
Thank you
is
so
that
much.
okay,
And
Councillor Idris?
Yes, thank you so much. And if I haven't said it before, it's an excellent report and very, very thorough. Thank you so much. Thank you.
Thank you. Councillor Spalding, please.
Thank you, Chairman. I just want to drill down a little bit, you know, and we're here to screw.
Yeah, okay. Yes.
5.3 and 5.4.
Councillor Spalding, can you switch off your camera now, please? Because your voice interrupting a little bit. And I will switch my camera as well, maybe if my voice.
Okay, so under 5.3, 5.2, the people who are most at risk, it seems to me from this excellent kind of research, these key national findings, that that black minority ethnic males, obese, diabetic, over 80 are 70 times more likely to die. Bangladeshi community, twice the risk. That sort of little demographic. We say in 5.3, we're trying to accelerate efforts to target culturally competent disease prevention and actively reduce inequalities. So if I could just, looking at 5.4, I want to ask these specific questions. I know the data won't be here tonight, but this is the key test of whether we've actually done this. I would like to know how many residents fall into this sort of ultra vulnerable category.
Yes.
And how many we've actually contacted. And how many of those have been tested? How many of those have been shown to be infected? How many were hospitalized? And how many deaths? In other words, I want to test statistically and scientifically how effective our program has been for our most vulnerable communities.
Member of communities, yeah. Okay, I agree with you.
That data must be available somewhere. And I think what we need to test that, because we're here to scrutinise that things are being done properly for our most vulnerable residents.
Thank you, Councillor Spalding. Eloquently put, and hopefully I'm sure any input on this, Huda or Gareth?
I can, what I can say at the moment is this is the initial scan, and we are working on this, and if, as the councillor suggested, we'll come back with more detail, working across the system, also with our colleagues on the CCG and the NHS.
Thank you. Thank you, Huda.
That's a good answer.
May I? Thank you so much, Councillor Spalding. I'm sorry, I have Councillor Williams. He wrote. Councillor Williams, would you like to ask your question, or shall
yes, if you can hear me.
Yes, I can, very clear.
Yeah, thank you. It was very similar to Councillor Spalding's, but again, are we really well set up to engage with relevant sections of the community if there is an outbreak? And we don't know which section of the community it might be in. But I mean, this must be the thing that's testing the authorities in Leicester. Hopefully we won't have anything that size, but we need to be able to act quickly. And that's why I've been asking about how are you getting the up-to-date data and effectively with wherever the outbreak occurs, whether it's in an institution or within a particular section of the community.
Thank you, Councillor Williams. Yeah, this is a follow-up from Councillor Spalding, the way he highlighted the issue there. Huda, please, can you respond?
Yeah, thank you for that question as well. We all have a role to play and to reach into the communities. And remember, we do have a community champions program. We have community development workers. We have strengthened as a whole organization our community engagement. I think we will, and we have the Interfaith Forum, for example. So there are a number of avenues. I think the test is, God forbid, if things like this happen, but we do have avenues into working with a whole range of representatives of the community.
Thank you so much. And then later on, yes, Councillor Williams.
Yeah, just respond on that. I mean, I have seen in the press some criticism, other parts of London, of a failure to engage early on with vulnerable sections of the community. I haven't seen any such criticism for Kensington and Chelsea. And I think what I can see, we've done quite well there.
Thank you so much. Well done. You finished, Councillor Williams?
Yes, sir. Yes, thank you.
Okay, thank you very much. Thanks so much for that. Any other question on this item before we move on to item A7?
Could I ask a question, Councillor?
Of course. Name, please. Yeah.
Councillor Rossi here, if I'm allowed.
Yes, Councillor Rossi. Yes, please answer.
A factual question. We're told that 502 people in the Royal Borough have contracted COVID, but elsewhere I have read or been told that we've had 170 deaths. So both figures can't be right. So I just wondered why there was a discrepancy.
Okay.
So 502 people, the figure I can imagine, this is the number of that I can imagine, but it cannot be the number of people who died. This is the number of people who contracted the virus, who we know of and have been tested positive. The 174 is the actual number of deaths registered with our RBKC registrar.
But I mean, that would suggest a much higher death rate than we're given to believe.
Huda, you're on mute. If you unmute, Huda.
Thank you. So sorry. So no, we have this definitely means that we have not identified by testing all the people who've had the virus. Remember, the testing the test and trace did not start until recently. Testing was delayed, and people's diagnosis was mainly based on symptoms and the initial aspects of the outbreak.
Okay, thank you.
Thank you, Huda. I have a question from Councillor Round, please. What's happening to this? Hello? Can you hear me?
Yes.
Okay.
Yes, I can. Sorry. Sorry. That took forever. Sorry, I'm really sorry about that. So I wanted to ask, and I think I believe I might have missed the question because my text's been a bit funny this evening. But I just wanted to confirmation on the Pillar 2 data, and also what the backup plans are in place in case we do need to act locally, and how much preparation we are putting into that.
Yes. May I take this?
Yes, please, Huda.
Okay. So thank you for raising this. So Pillar 2 is the testing that's being done through the test and trace service. People reporting symptoms being tested and their contacts being tested, and so we do get the data on a daily basis based on postcode, and we are looking at this now and try to identify, if there are any clustering in the communities. So far, the numbers are very small, and there are no clusters as far as we can tell in the borough. And I can't tell you how much we are preparing. We have our outbreak control plan that we have put in place. We have practiced outbreak control through what we have done, sadly, through care homes initially. We can manage outbreaks in schools. We have a system for it, and we're looking at how we manage outbreaks in a workplace or outbreak in a kind of setting for homeless residences. So yeah, we are doing our utmost best to prepare for any eventuality.
Thank God. I hope. Are you satisfied, Councillor Round?
Yes, thank you very much.
Okay, pleasure. Councillor Shohan, I can see you have a question in the chat, but no?
Hello, can you hear
me? Yes, of course.
Wonderful. Just a couple of questions. I'll just start off with the question on the
Yes.
The recommendations from the PHE report, section 5.3, item 5.3. And I just wanted to echo, first of all, Councillor Idris's comments on congratulating an excellent report here, a very comprehensive report. And my questions are effectively a follow-on question from Councillor Spalding and Williams. My question is around bullet point 3 on this item 5.3. The full text of this recommendation includes regular equity audits, use of health impact assessments, integration of equality and quality systems into quality systems, but more importantly, good representation of Black and minority ethnic communities among staff at all levels. And it goes on in the full report saying that the sustained workforce development and employment practices should be in place with trust-building dialogue with service users. I just wanted to know, will these be in some form of action log going forwards? If you could just expand on that, please.
Yeah, officers, either Huda or Gareth, please.
I think whether it's an action log as one does in an emergency planning, I don't think we are logging day by day what we are doing on this, but certainly I think you hold us to account on how we are responding to these. As I said earlier, you requested more information. We need to get that to you. We need to respond to how we are working as a whole system, whether it's in public health or with the NHS or others, in terms of equality impact assessment and the outcomes of what we are doing. So this is, as I said earlier, this is the start of it, and you hold us to account for that.
Right. Thank you so much, Huda. And Councillor Healy, please. You raised your hand earlier.
Yes, thank you, Chair.
You're welcome.
I just wanted to ask some questions about the impact on residents of care homes. I'm aware that it's difficult to be very specific for the danger of actually identifying people. But I wondered, for example, I know the aim is that all care staff and residents should be tested, but we are at an early stage. Is it possible to say how many have been so far tested? Do we know how many people have died in care homes? Have any care homes had more than 2 people with COVID symptoms? And finally, separately from that, could we know who is going to be on the new member-led health protection board?
Thank you, Councillor Healy. Officers, either Huda or Gareth? I think Huda in this case, yeah.
I can answer some of them in terms of the testing arrangements for care
yes,
homes.
please, Gareth. Yeah, thank
maybe
you.
On the member-led board, but so the arrangement that was put in place at the end of May and the start of June was for all staff and for all residents of care homes to receive a swab test. So after that point, we did get results back for everybody in that position. We then made a case in line with the guidance from public health that there ought to be a process of retesting staff and residents in order to make sure that we could anticipate and manage the risks of any outbreaks or infection control as closely as possible. And I'm pleased to say that since this week, that process has started to roll out across Kensington and Chelsea. And so all of the care homes are being retested and will be so on a fortnightly basis, so that we are able to respond quickly to any changes in our understanding of the situation. In terms of the numbers of people that have died in care homes, that is reported publicly from figures through the Office of National Statistics, and the most up-to-date number of that is the total number of deaths recorded since the beginning of May is 24 for the Royal Borough of Kensington and Chelsea, very sadly. And if I may, I'll pass over to Huda in terms of the member involvement in the board around the outbreak response.
Thank you.
Unless Councillor Addenbrooke wants to say anything specific, this is still being considered as far as I know.
All right.
Sorry, if I could just add, yes, it is being considered, but this is also going to the Health and Wellbeing Board.
Okay. Thank you.
Okay, thank you, Councillor Addenbrooke. Yeah. Councillor Healy, do you want to follow up on some of your questions?
That's fine, thank you.
Thank you so much for all your questions. Can I now open it? Oh, Councillor Addenbrooke, she wants to follow on. You have a question?
I don't have a question. I just wanted to thank all the officers in the council, but particularly in adult social care and public health, for everything they have done in response to this pandemic. They have worked every day, every night, every weekend, and I think they've done an amazing job. So thank you.
Thank you so much. I add that compliment to you, Councillor Addenbrooke. I think our officers are really risking. I've seen some of the engagement team even reaching out and risking themselves in exposing their work. Much appreciated. Yeah, thank you. Councillor Chauhan?
Yes, I'd just like to echo those remarks as well. I would like to commend the early action on 6th of March with daily calls to the care homes, which continues 7 days a week, and also the head of national guidance on the 9th of March, reading the national guidance to minimise corona risks. So well done, everybody. I think it's a really an exemplary effort. I just have one final question, if that's okay.
Yes, please.
In section 9.4, I just want to understand what non-costed support for care homes means.
Okay. Clear on that. Yeah, anyone can respond to that, please?
Yeah, sorry. Sorry, could you sorry, could you point to the right bit of the report? I can't see that in section 9.4. Oh, sorry, then table 2, the non-costed.
Yeah, table 2, 9.4, yeah.
That's so the difference between costed and non-costed. Sorry, forgive me, I was flustered there. Is where there's something where we'd actually hand over money or materials, such as in the top table, PPE, so personal protective equipment, or financial support in order to be able to recruit temporary staff, or to make sure that staff could continue to be paid who might have had to isolate. So that would be costed. Uncosted is where it's really kind of support in kind through advice, support around infection control, guidance on how to use personal protective equipment. So that's not kind of money being handed from the local authority to a care home, but it's support in kind through advice and expertise, etc.
Thank you so much, Gareth.
Yeah, that's fine. Thanks very much. Thank you.
Thank you so much. Anyone from the? I received. I now open it to the councillors in the not on the committee. Do we have any question there? No. I have one question from the. Oh, sorry. Yes, Gareth. You want to come in, Gareth?
Mistake. Sorry.
Mistake. No problem. We are all dealing with this new technology. I hope it will just be kind to us through this pandemic. We received one question from a member of the public on this item. It is a question addressed to the leader of the council, and I will ensure that it is passed on to the leader for her to respond. Any other member of the public have any questions? So I conclude this item, A6. I assume those statistics, or when it comes, the officers will send it to us and the councillors concerned for further clarification. Thank you, Huda and Gareth, for this paper. And you are welcome to stay with us, or you have a nice evening. It's up to you. But thank you so much. I will move on to item A7. This is the Health and Watch Central West London report on coronavirus in local engagement. Health Watch carried out an exercise of listening to residents and sharing their experiences during this pandemic. The intelligence they have gathered is being shared with health and local authority partners. Now, I would like to ask Olivia Klimmer of Health Watch to present a report in explaining Health Watch work to this select committee. Thank you very much. So you are welcome, Olivia, please.
Hi, Marwan. I wasn't expecting to get to present, so that's absolutely fantastic. I think Christine, my chair, is on the committee, so we were sort of preparing to take questions really on the paper. I will take the opportunity though to just flag up a few of the
few items,
the themes coming through. So in regard to, we did an initial survey with one very open question, and that helped us to shape this in terms of a research agenda. It's also being used more widely across the country. So Health Watch England have sort of run this very similar survey that's gathering data, but we were quite early. So sort of a pat on the back for us all locally. Lots of things around mental health coming through, and that feeling of isolation, those concerns about resources, work and their colleagues. I would also like to draw to councillors' attention the detail that we've drawn out around BAME communities and the differences in how they are responding and experiencing the pandemic, as in delaying seeking help, not necessarily having the support network around them. And another theme is around sort of carers and the experiences they're having, but I think I'll leave Christine to pick up on that as well. I just wanted to flag back on that earlier piece from Huda in terms of community engagement. Well, you know, we are your local Health Watch. We are a statutory function, and we are here to provide that as a piece of work, subject to funding, etc. But please engage us and involve us in those conversations that you're having and the planning in terms of how to reach into local communities, because that's what we do. So we'd be delighted to work on that. And certainly in regard to experiences of residents in care homes, we've also got another piece of work running on that. That's been a slower and a harder piece of work to do, understandably. But we are having conversations, and we have a separate survey going out. So I'm sure councillors will have had an opportunity to look at the paper, and I'd be very happy to take questions. I hope I haven't overstepped the mark. I'm sure my chair will step in if I have.
Thank you so much, Olivia. No, it's nice over all of you of your work, and of course we are happy to continue working with you. You picked up a very interesting piece that you would like to explore further, which is the care home, because it's a very disturbing stories. That this is during this pandemic. This is the group which is being affected the most, and this is shocking. So yeah, definitely you will have further engagement with you on that. But now I will open it to and now before I forget, I mean, you have one professor, she's interested in that, so you can reach out to her, Professor Manika. So please do reach out, and this will be a great effort to ease a burden, especially for people they delay seeking help. This should be it's a disturbing. We should know why people are delaying seeking help. Is it what kind of parameter? Why the reason for that? This is very important.
I mean, we've
so
had
now
the
I open it to Lydia. Tell me,
So I was going to say, we've had the opportunity to take this to the London Region COVID-19 coordinating meeting, and we've had meetings now with Public Health England, London Region, on the work that we're doing. So they're very supportive, and I think our goal is to get this information to as many people who can make decisions as possible.
Thank you so much. Thank you for all your effort, which I really appreciate. I will open it now to the committee members to ask questions, please. Who would like to start? Please speak up, because now I cannot see any. I can see 2 hands up, but I can't see who.
Okay.
To be honest.
I have a question. Well, a couple.
Oh, Councillor. Okay, after Councillor Idris, I can see you now, and I can see Councillor Williams. So, Councillor Idris, please. Yeah.
Okay. Thank you, Chair. I have more than one question too. Again, here. My first one is on the overview key findings, where he said it's not clear how people were selected by the government, and I was wondering whether that was just not knowing, or was it deliberate, or and there was there any explanation as to why you know, the letters went this way? That was one question. My second question is in the same page, is people delayed seeking help to not get infected. Do you think that fear will continue after COVID? And what are we doing about it? Because some illnesses, if you don't detect them early, say like some cancers, they can really become serious, and time is of the essence in these cases. So what are we doing in making sure that people gain their confidence back? The third and hopefully the final one for me here is also in carers and parents. It's the last point where it says during self-isolation, you reported that some of the Black and minority ethnics have a great percentage of negative outcome when they go and see pharmacists and family GPs. Why do you think that is? Is that a language barrier? Because I understand we translate every leaflet into multiple different languages. So do we have a way of, I don't know, maybe it's a language barrier, or is it confidence, and I don't understand why. What do you think the reason is? And my final thing is, what are we doing as a council to assist, to help people combat loneliness and isolation? Thank you, Chair. That's all my questions.
Thank you, Councillor Idris. Very rounded question there. Yes, do we have any comments, answers?
Yes, sorry, Christine.
Can I come in perhaps on some of these? Is that all right? In talking about the shielding, yes, there has been a lot of confusion, because there was an initial list which was then added to by some of the hospital trusts, so that the people really are a lot of people have been quite unclear about whether they're on the list or not. And I think that this is an issue that will need to be looked at going forward, particularly if there's a surge,
right,
so that people actually do know who is going to be on that shielding list. The other one that I wanted just to say something about is the question of delay, because as well as delay, there's an issue about the outpatient appointments, and people not knowing whether their outpatient appointments are going to happen or not. So again, there's confusion around that one. And I think that there is a danger that the delay will go on. And you're quite right that there is a great danger of other conditions that aren't being addressed because of people's fear about going to their GP or going to hospital.
Thank you, Christine, for this clarification and highlighting it as a critical action need to be looked into. And this should really form a priority, I think, from the action. I will welcome now Councillor Chouhan to comment, please, or ask question.
Thank you. So I just have a question, again, following on from the overview of key findings on the third last bullet.
He is now joining.
Can you hear me?
Yes, I can hear you. I hope that the rest can.
So the question is on planned NHS appointments. Now, it says here a lot of these appointments were cancelled in the hospital, community services and dental settings with no communication. Can these organisations, especially the providers, be identified so that they could provide an explanation and receive some feedback?
Yes, absolutely, Councillor. We have, Christine and I have had meetings so far with West London CCG. I've met with CNWL today. We have a meeting with Imperial, Tim Orchard tomorrow, so we'll certainly be able to give that feedback.
That's
lovely.
Very helpful. Can I just ask another question?
Yes, Councillor. Yes.
So the question is about the sample size. I believe that the sample size for this survey was 200. Is that correct? Or
so
the result of the survey?
So I think I haven't got the numbers right in front of me, but we have got those referenced. So we keep it as transparent as possible in terms of responses, certainly.
So the reason why I asked that is clearly it's been well received, and I think you mentioned that Health Watch England is beginning to expand the survey. Is that the same survey being rolled out nationally?
It is, and so each Health Watch has been, so because we were so very early, and that is a thanks to our boroughs, Kensington and Chelsea being so supportive. But yes, we were very early with getting that general first question out, which enabled Health Watch England, and we worked with them on that to shape an appropriate survey, which then can be tailored to local Health Watch needs.
So you'll get a larger sample size. That's great.
Thank
you very much.
They will do.
Okay.
Right.
Cheers, thank you.
Councillor Williams, I can see your hands up, but is it before or you want to ask now?
Yes,
Councillor
I want to ask now. Olivia, as you heard my comments earlier to the Director of Public Health, perhaps I misunderstood you, but you seem to suggest that Health Watch is a great resource on community engagement and that perhaps our public health department isn't making the best possible use of you in planning their outbreak control plan going forward, or perhaps I misunderstood that.
I mean, Christy might step in, but I would very much welcome the opportunity to work a little bit more with our public health colleagues on this. I've shared the data and I've met with one of the team on the JSNA, and it was a very busy time for officers, very understandably. So now is my moment to make the most of it and make that offer for that contribution. But thank you for the question, Councillor.
Thank you.
Thank you so much, Olivia, for this paper and for the time and your effort to work closely with stakeholders. Identifying the problem is half of the solution, if we can see it that way. And there are members of the section of the communities, the BAME communities, who are really in the forefront, who've been affected greatly in this pandemic. So we need to have a closer monitoring to this effect. And hopefully this will be the start of addressing this issue, because we don't want to lose our doctors and nurses from this section of the community. Councillor Idris, you want to follow up a question? I can see your hand up.
Not a follow-up. My last question was about the last point in carers and parents, and where it says members from the BME community mostly used local pharmacy, family GPs, but a very big percentage of them felt had negative outcome. That is not helpful. So I was wondering, why is that? Was it a language barrier? What was the reason for that? Thank you.
And I have to say, we've just circulated a report of work we did with the BME Health Forum, which echoes those experiences. So it can be language barrier, but it can also be sort of miscommunication, or there'll be many factors, and those threads also pick up in the digital issue, in translation, and the reliance on digital as a response going forward. So I haven't got all the answers, I'm afraid, but we're certainly flagging up more questions.
Yeah, I can see this is a further area for research to address what the questions being highlighted by Councillor Idris, and surely you pointed your signposting. This need to be a further study on this area. It looks like it. So, yeah. Thank you so much anyway for highlighting it, and at least recognizing there is something need to be addressed. Any other councillors from the committee before I opening it up to the other councillors who are not in the committee? Councillors outside the committee, please.
Yes,
do you have any question? Yes. So patient. Okay, Councillor Evans.
Yes, thank you for this great presentation, and thank you to all the officers and all of the people who reported tonight. It's been an amazing effort. I've seen it throughout the community, and hats off to you. I wanted to ask about the online services. They've been hugely successful. I had one consultation and I thought it was very good. And I was wondering, for people who are afraid, if they are able to go online, will they, my consultation was without visual, and I was wondering if you will be increasing visual, having had such good success with that. And because of the numbers, and because going forth, we still have COVID as a priority, what are your plans with digital services, including visual, please?
Thank you.
So is that addressed to Healthwatch, that question? Sorry.
It is, yes.
Okay. Well, we're part of the regulatory framework for health and social care. We don't deliver services. We would be recommending. We capture the voice and experience of local people using health and care services. So indeed, the digital offer has reached more people, or made it more straightforward for a good many. But it's balanced with those, the rounder picture perhaps that we're able to bring forward. The solution's not in my remit, but it's certainly something we will bring. We bring to the attention of those who commission, design, and deliver health and social care services.
Have you had positive feedback from the community on digital services?
We have, and I think that some of that is reflected in our reporting.
Yes.
And so I don't know, Christine, if you wanted to come in, or it certainly is. That's what we're hearing as well, because.
I think we're getting.
Yes, Councillor Evans, what do you want to clarify on this report regarding involving digital services?
Right. We did a report last year on young people's use of digital services, and although they were welcoming it, I mean, just in brief, there were also problems that they were picking up, particularly around privacy and use of data. So that's one consideration. The other is that in the recent increase in digital consultations, it has been very helpful for some people, but there are people who are digitally excluded, or who find digital difficult, And that is an issue that has come up in our focus groups around people whose first language isn't English and who need a translator or need longer in order to be able to communicate through an online app of some sort.
Yeah.
And I have
yeah, thank you so much. Yes,
sorry, Mark. It's Councillor. If I could just say, Christine's flagged a really important issue there, which we raised earlier with CNWL. It is around privacy. So when people haven't got a lot of space at home, having an online consultation can be difficult, and CNWL are picking that up, particularly in regards to sort of support and counselling where the subjects are sensitive, their families don't necessarily know, or the individual doesn't want their families to know. So there are issues around it.
Thank you very much.
Thank you.
Thank you.
Thank you. I think I have to conclude this paper. I haven't received any question on this item from the public. So may I conclude this item, please? Thank you. Now, thank you so much, Olivia and Christine, for this engaging session. And you have our full support in this initiative, because I can see you are really targeting a very interesting area, especially in this digital age, which is just opening the horizon for us in a completely different domain to address. But thank you very much for this report and this level of engagement, and reassuring us that you are still engaging with the other stakeholders in this area. So thank you so much tonight for your time on behalf of the committee. Can I move now to item 8A8 on the Grenfell update? As you know, Grenfell recovery is a #1 priority in this council plan, and it is part of our work program. Now, scrutiny of the adult social care and health dimension of Grenfell recovery takes place through this committee, and members have an ongoing interest, which is why I have asked for this report. The one I believe who is going to introduce this report is Callum Wilson, who is the Director of Grenfell Partnerships, Udal Sharif, Interim Director of Public Health, and Gareth Wall, Barbara Director of Integrated Commissions, are all the officers that will present the report and will try to answer your questions. May I ask whoever going to start, you are welcome to start.
Hi Marwan, it's Callum.
Callum,
hello everyone.
Hi, good evening.
Good evening, I hope you're all doing well. Yeah, so the paper is split into 3 sections. So would you like us to all do a short introduction and then take questions?
Yeah, short introduction.
On all the
yes,
aspects?
please. Yeah,
Great.
just
Okay,
signpost it, and then we can go for discussion.
Perfect. So this paper follows on from the much wider overview paper that was taken to the Overview and Scrutiny Committee at the beginning of June, which served as the first formal update on the Grenfell Recovery Strategy, which was published back in January 2019. So that paper worked as more of an overview of the whole programme, and then we have taken 3 papers. This is one of 3 papers where we are providing more detail. And in this paper, we're covering the specific provision that's provided through a dedicated service that I am responsible for, that's for the bereaved survivors, and other aspects that Huda and Gareth will introduce. In terms of the dedicated service, probably just as a very quick overview, the service has now been sort of formally up and running for a year, informally since April 2019, but properly through July 2019, and the paper provides a more in-depth overview, listening to the feedback from the Overview and Scrutiny Committee, a more in-depth overview in terms of what the service actually constitutes, how many people are accessing it, the types of responses and feedback we're getting from those people, so that the committee can have a better understanding and ability to scrutinise the provision is obviously of paramount importance to the Council, that being the support provided to the bereaved and survivors. Here, I'll pass over to Gareth to introduce the second part of the paper.
Thank you, Callum.
Thank you, Callum. Yes, the section from adults is section 3 of the report, which describes the work that commissions and adult services have done with organisations that are part of the Grenfell Recovery Strategy, and in particular the group Together for Grenfell, in developing their offer, so providing ongoing support, working with them to enhance their sustainability as organisations. So as the funding position changes, making sure that there is a series of mixed income streams available, and that those organisations become well versed, as many of them already are indeed, in how to apply for funding in order to respond to the needs and requirements of funders. That support has been provided through our teams. We've also, building on from the previous item we discussed in relation to COVID, have been working with the organisations that are funded through adult commissioning, and in particular through Together for Grenfell, to advise and support them on how they can work with those residents who they would normally be working with in safe ways during the last 3 months or so. And as you can see in the paragraphs 3.9 to 311, the sorts of things we've been working with them on, which includes some of the digital access to service to maintain connectivity and avoid isolation, and also therapeutic support, giving people an opportunity to talk to counsellors, not counsellors, in terms of the assistance that they might require. There is then further along some specific detail on what the groups that fall within the Together for Grenfell umbrella are providing, and we will be continuing to work with them over the coming year on the basis that I've just set out in the introduction. Thank you.
Right. Thank you so much, Gareth, for this overall view. Huda, do you want to come in on the final part?
Thank you, I will. So the third section of the report is on top of all the service provision that colleagues outlined, is what we are doing to understand the needs of the population and to monitor what's going on. And so this work is overseen by an public health implementation group that has as equal partners our colleagues from the CCG and Public Health England. And we are really working hand in glove with the CCG colleagues. And it has 4 key areas that we are working on and have delivered on. One is a survey. The council has made a commitment to survey the local people of North Kensington for 5 years, really, to understand the impact and the recovery, how the community is recovering from the tragedy. And so the first survey was completed and results were reported back to the community. And I must say, it's a really impressive sample size, 1900 survey for the size of the area, 1900 people. It's really a really substantive size. The other element of it is understanding, having a finger on the pulse on what's happening in terms of health outcomes in the population. There was a health needs assessment that was done a year on after the fire. It's just year on year to understand how the indicators are changing. Again, we've done the report, the actual analysis, but this really need careful interpretation. And as soon as we have done this, we will, of course, in an open and trusting way, we will share this with the community. The third area is about very much working again with colleagues in the NHS. Sorry, before I move to this one, I wanted to say that the population monitoring is on anonymous basis, 38,000 people. So the data on 38,000 people, but none of this is identifiable, is being analysed or has been analysed. The third area is the working with colleagues in the NHS, and it's mostly an NHS-based system that is governed by the rules of governance and information sharing within the NHS, and nothing to do with us individually. It's about the case management of everyone who's been bereaved and survived from the tragedy. And the fourth point is obviously communicating with the community, whether it's the assembly, reporting back on the survey, and reporting on, involving them while working with the community in various health campaigns, etc. So this is really the essence of this bit of the report.
Thank you so much for that. I can see, especially in terms of the survey analysis, there are so many things we can draw from, and this analysis. Is it? Can we have it available? Would member of the committee will be interested? Certainly, I'm interested. I haven't seen that report yet.
I'm sure.
You will send it to us, yeah?
Sure, you can share the report, absolutely.
Thank you so much, Huda. Very kind. Yeah, thank you very much for this column, Gareth and Huda, for the roundup of this report, which is signposting us to different area. Now I open it to questions to members. Any members would like to ask a question? Sorry, you're welcome. Any aspects of the report? I can see Councillor Idris, hands up, please. Go ahead.
Thank you, Chair. This time you'll be glad to know I have only one question. It is.
I'm glad to hear that. Thank you.
It's on page 2.
Yes.
And first paragraph talking about dedicated workers. And the second line, it says dedicated service workers support bereaved and survivors to focus on areas that are most important to them for their personal recovery. My question is what areas of support did you find to be more important for them to focus on?
My word, that's a beautiful question, Councillor. Yes, anyone? Callum, would you like to take this one on, please, or Rhoda?
Yeah, of course, and thank you, Councillor. So in terms of the areas, so during the consultation process the first consultation process that we undertook when setting up the service, we tried to listen as much as we could and hear and feedback and reflect on the things that bereavement survivors are telling us they wanted the service to be able to support them with. And we ended up calling these, in collaboration with the bereavement survivors, life areas. So support plans that people can complete and only have to complete as much or as little as they want, are split into 5 areas. And they are health and well-being, which we work very closely with consent with our physical and mental health partners from the CCG and CNWL, work and training, housing, and that's both around the rehousing process, but also settling into people's homes, which is so important. But also for people who didn't live in the tower, who are bereaved, who are also accessing the service. Obviously, housing management and safety in one's home has become more important to people. So we also support in that area. Education, both for predominantly with children, but also for young adults as well. And then sort of more of a catch-all, which is leisure and activities, which is governed by the best practice research regarding, to enable people to move forward and to recover. It's important and vital that there are ways for people to come together socially and connect, and also to begin to sort of remind them, it's such a long journey, remind themselves of the things they like doing and to being able to do that. On average, the splits in terms of the amount of focus we have generally is sort of weighted towards health and well-being and housing. Education and leisure and activities come close second, and then work and training is really not far behind. But so overall, it's really quite a wide breadth and really quite even. And as I say, the way we try and work is, or do work, is that if a bereavement survivor, if a bereavement survivor only wants to work with us regarding their health and well-being, there is no requirement for them to have to fill in or discuss or raise any other matter. It's very much led by them, but structured under those areas. And of course, if there was something specific or particular that people wanted support with outside of those, we would of course provide support there too.
Okay, thank you.
I think it's quite reassuring, differentiated, actually, I can see a service which is showing quite good improvement. I wish some of the bereavement survivors are here with us today as well to have their input. Definitely, hopefully we'll invite them at our next meeting. But thank you, Councillor Idris, for your question. Okay, any other member of the committee, please, would like to ask any question on this paper? No? You are all satisfied? Okay.
Chair,
can I open it? Yes, sorry, again, I give enough pause.
Can I just have my thanks to everybody in the dedicated service, because obviously this has been an extremely difficult time for the bereavement survivors.
Yeah.
With the inquiry paused and COVID-19, I think, again, they've been working above and beyond. So thank you.
Thank you, Councillor Addenbrook, for that input. I share your dedication on that. Yeah, absolutely, especially in this stressful environment where our officers are working hard to reach and keep the same momentum going, especially in North Kensington. We are being compounded, by the tragedy, which we are just gone through the 3rd anniversary, which still, like, believe me, I live here in North Kensington. It's like happening yesterday, unfortunately. And the COVID, the coronavirus, which we are all scaring time for all of us. So thank you again for all the efforts, this joint effort together to overcome this pandemic.
I should have
you so much.
added our thanks to our health partners, because they've been working really closely with us on COVID-19.
Yes, I've done it.
Dedicated service.
I've done it on behalf. Yes, absolutely, Councillor Addenbrook. Thanks so much. It's quite a stressful time for all of us, but thanks so much for all the efforts. And any other question before I move on to the other councillors, our colleagues outside the committee? Anyone else? No? Now, member of the public, I have one question, series of questions. We received some questions from member of the public who is a resident. I read them all together, so officers, they feel at ease if they come within your limit or if you want to write to us. There are 3 questions, and I will start with the first one is on engagement. The other one is on trust, which is still shaky, seems like in some residents' eyes. And then another one is on Professor Appleby's report. So I will read the first engagement question. And this is from the resident question. Given there has been no real engagement, co-design or co-production of services when residents have been promised this for the last 3 years, with the possible exception of Lancaster West Residents Association, in bracket, who have no mandate or mechanism for representing the rest of the 11,000 affected by Grenfell, whose needs the council and the NHS still have a duty to serve, close bracket. May we please have a concrete inclusive outline and timetable for both RBKC and Central and Northwest London NHS Foundation Trust of how and when we can expect this long overdue promise to be delivered. I will read the second question so officers can prepare. On the trust, given the significant failures by all 3 bodies to keep their promises to residents, even once made publicly by RBKC Elizabeth Campbell, Councillor Elizabeth Campbell, our leader, Taidri Moroni, Robin Doran, and Mona Hayat, what resource do residents have what accountability is there, and what incentives do CNW, West London CCG, and RBKC have to honor promises made to the Grenfell affected North Kensington community? How do these bodies intend to rebuild the trust of the community, which they have squandered and betrayed for the last 3 years through repeated broken promises? And the final question regarding Professor Appleby's report, when will this be published, and have any interim improvements been implemented by either RBKC or CNWL in their COVID-19 response pending the major recommendation Professor Appleby report contains for both bodies? Finish the question. So who would like to take the answers? If we cannot answer now, we can provide a written response. So Councillor Addenbrook, please, you put your hand up.
Yes, okay. So in respect to the dedicated service, which this select committee is looking at today, there continues to be considerable engagement and co-design of services. This has taken the form of formal consultations, surveys, QA calls and feedback, regular engagement with representative groups, monthly meetings to review and develop the service with the steering group. In terms of the wider aspects of the recovery strategy, this detail is reported to the Housing and Communities Select Committee, and a paper is going to their next meeting on the 20th of July. In February 2020, the West London CCG launched the Health Partners Programme, aimed at working with the community, voluntary and faith groups, resident associations, charitable organisations and health providers to ensure that they engage as widely as possible moving forward. The NWL is happy to work with the community on further co-design and co-production of resources. Documentation in relation to COVID-19 response may not have been well designed and co-produced as they would have wanted to. So I think they acknowledge that they could have done better there, and that this is not the way they would prefer to continue working. On the Professor Appleby report, I don't believe this has been issued yet, but maybe Huda or somebody else can answer that one for me.
Thank you, Councillor Addenbrook, for your answer. Huda or Gareth?
I can attempt unless there are colleagues from CNWL in the room.
Yes, anyone from CNWL would like to take this question?
So the report has not been published, and but it doesn't mean that we are not taking, I mean, mental health, we are taking it extremely seriously. This is one of the areas that have been exacerbated by COVID. So yeah, so all the work we're doing around suicide prevention, mental health interventions is really enhanced, and I'll be happy again to brief the committee on what is going on that front.
Thank you, Huda. That's I think satisfactory as far as I'm concerned. Anyone want to comment from the committee? No? Yes, I have a hands up. Who's that? Mary, please, can you come in?
Hello.
Hi, good evening.
I'm Mary Mullix. Good evening. I'm Mary Mullix, and I'm the director for the North Kensington Health Recovery for West London CCG commissioning. Just to confirm information from CNWL, they have not received the report from Professor Appleby prior to lockdown, and one of the priorities that was given was a commitment to feedback to the local community, and that would have been difficult during lockdown.
I see.
Professor Appleby particularly wanted to comment on the issue of COVID and suicide. And there is a concern that the issue of suicide would not get the attention it deserved during the coronavirus pandemic, when attention, including that of the local community, was elsewhere. So CNWL are still linking with Professor Appleby with the intention that he will work with the community much more directly once we're able to do that in a safe manner.
Thank you so much, Mary, for that clarification. Much appreciated. Any other comments? before we move on? Now I move on to the public councillors outside the committee, please. If you have any question, I'm happy to take on now. I can't see any hand. Please put your hand up or speak. I don't see anybody else apart from the committee. So, and we haven't received, I mean, this is only questions from the public. So we dealt with it as far as we can at the moment. And thanks, Mary, for the clarification on the Professor Appleby report. Much appreciated. So thank you so much, Huda and Gareth and Colin for your report. And let's conclude item 8 for the Grenfell update. Thank you so much, and have a good evening. And you are welcome to stay on if you like, unless you have something else better to do. Thank you. Now I move on to item. We need rest, don't we? Now, for item A9, the scrutiny report on palliative care in Kensington, Chelsea by Councillor Williams. There has been unease among local residents of neighbouring boroughs about changes to palliative care services proposed in Central London and West London Clinical Commission groups for the new model of palliative care. This proposal was a result of the publication in June 2019 of the independent review on palliative care.
Is now exiting.
And it included plans to close the inpatient unit of the Pembridge Hospice in North Kensington. The Adult Social Care and Health Select Committee set up a working group to review the proposals made by the CCG on palliative care last October 2019. Councillor Robert Freeman will introduce this update on the review and on what is happening about the palliative care in the current pandemic. So may I ask Councillor Freeman, please, to introduce the report.
Thank you very much, Chairman. Can you hear me?
I can hear you myself. I hope the rest of the committee can.
Thank you very much for your introduction. And just to give the background, the Pembridge Hospice goes back to 1982, so it's been going a long time. And in 1998, it moved into the St Charles Centre. And at the same time, responsibility passed to Central London Community Healthcare Trust, CLCH, that was formed in 2009. Pembridge Hospice is a 13-bedded unit with individual rooms, and in 2018 provided both inpatient and community care. On the 1st of October 2018, inpatient admissions to Pembridge Hospice were suspended following the resignation of the consultant. For a palliative care end-of-life care unit to operate, a registered consultant is required who must be on the specialist register for palliative care. The recommendation is in fact that there are 2 consultants for reasons that I won't go into unless anybody wants an explanation of that. CLCH was unable to recruit a suitable replacement, and the hospice remained closed to palliative care patients. It's now reopened to patients recovering from COVID-19. I did see an advertisement during the lockdown period for a consultant by CLCH, and I've asked them for an explanation. I'm yet to hear back from them. But the unit continues to provide community and nursing day care. In November 2018, Central London CCG, and the unit is actually commissioned by Central London CCG, although it's in our borough, and the reason being that the whole of CLCH is commissioned by Central London CCG. That's the CCG basically for most of Westminster. We have part of Westminster with us, but most of Westminster. The consultant was Penny Hansford, as the report says, who was an independent consultant and a former director of St Christopher's Hospice in Sydenham. The report is lengthy, but in summary, the preferred option was to close the inpatient unit and for patients to be referred to St John's Hospice in St John's Wood or the Trinity Hospice in... This was massively unpopular. We had a meeting in the town hall which was fairly lively, and there were even more lively meetings in Hammersmith and Fulham town hall that I went to with some fairly angry words. As the report which Paula Portas has prepared says, with the pandemic, there has been a massive change in the way that palliative and end-of-life care is delivered. The financial and health pressures on hospices have been absolutely enormous. If you look at both Trinity and St John's, they are continuing to take our residents, but both of them are charities. So if you look at Trinity first, it has always received very little funding from the NHS. Most of its funding came from its 31 shops, the balance coming from its fundraising events. Fundraising events have been impossible, and all of the 31 shops were required to close. 3 of them have now reopened on an experimental basis, but according to the chief executive of Trinity, she thinks that many of these will probably never reopen. The government has provided some relief for the whole sector of £200 million, but neither Trinity nor St John's have received any substantial help. Trinity is continuing to operate for the moment with redundancies and furloughs, but the next 2 or 3 years are going to be absolutely critical. St John's is housed in the Hospital of St John and Elizabeth and was funded by the private elective surgery carried out at the hospital. That has been suspended, and the hospital has been taking COVID patients from the NHS so that this funding is not available. Services have been very severely cut back, with again redundancies and furloughs, and among the redundancies, they've made their chief executive redundant. Unless there are substantial changes, both of these very special institutions are under threat. So if there are any questions, Paula or I will try and answer you to the best of our ability.
Thank you so much, Councillor Freeman, for all the efforts, all your kindness in putting this initiative to the forefront and leading on it is much appreciated. It's very disheartening to see this happening, and the support being undermined by this COVID, where we see, as you said, the lifeline, 31 shops, is only 3 reopened and the rest threatened with closure. I mean, for the shops owners as well as the charity is going to suffer considerably. So how this is going to survive?
Explain, if I may, Chairman. The shops are all owned and managed, or were owned and managed by Trinity, and they employed the managers, but it was largely staffed with volunteers. And I think Trinity had something altogether like 600 volunteers, some of them actually in the hospice and some of them working in the shops. But it's really impossible. A lot of them are very small, and social distancing is very difficult in them. So the loss of income is enormous.
Yep. To be honest, I would like to open it and learn more about this because my knowledge is limited on this, but definitely for the committee to discuss and see a way forward, what we can do, what level of support can be provided when this lockdown is lifted. So I will like any member of the committee would like to initiate, ask Councillor Freeman any question, any clarification, comments. No comment so far, except, okay, Councillor Johan, please, welcome your contribution.
Thank you. I just have one question. Given the unit opened during the COVID pandemic, who provided the consultant cover? I'm not quite sure about where the consultant came from during this period.
Sorry, which consultant?
For Pembridge.
The Pembridge consultant. The consultant is a consultant in general medicine. It's not. It's not opened as a palliative care hospice. It's opened as a general unit for patients recovering from COVID, not for patients who are believed to be at the end of their life. I mean, I know you very firmly believe you could find a consultant, which we would all be mightily grateful for if we can find a palliative care consultant. But no, it's not able to open for palliative or end-of-life care. It's opened as a general medical unit for patients recovering from COVID-19.
I thought we found a solution temporarily. Okay.
If only. We're all really hoping for it. And as I say, CLCH, I saw, were advertising for a consultant again, strangely during April. But the last I saw is that the position is no longer open. And I did write to CLCH to try and find out what's happening, but they haven't responded to me yet. Obviously, if they do, I will pass something on to the committee. Very happy to do that.
Thank you, Councillor Freeman. Thank you.
Thank you, Councillor Freeman. It's much appreciated. Yeah. Any other colleague? Councillor Addenbrook, please. Yeah.
It was just to add there that the Community Palliative Care Service continued to support residents in their homes or in other settings during this period, because obviously, as it was commissioned for COVID step down, they couldn't be treated there.
I see. Okay. Right. Thank you. Thank you, Councillor Addenbrook, for the clarification there in the comment. Any other councillors on the committee would like just to add any comments? No. I will open it now, please, to the other councillors outside the committee, if they have any comment, any question. No? No question, and I've received nothing from the on this one, to clarify on this, we received no question from any member of the public on this. So Councillor Freeman, I mean, thank you so much for the effort you are putting there and the leadership showing in terms of addressing this is very sensitive issue, especially in the critical time we are facing at the moment. So how do you see a way forward now, Councillor Freeman?
I've tried, well, I have discussed it with the Chief Executive of Trinity.
Yes.
She says, I've asked her, which is the obvious question, what can we do to help?
Yes.
And she has said, what we can do to help is to get the commissioners to give her more support, because they get very little support from the NHS. So if we can do that, I think we've achieved a lot. And
so we can have a joint effort there.
I think that, and thank you very much for asking me to present this to you. And this is basically my bowing out from my involvement with adult social care and health. So I pass it on to you, pass the baton on to you. Obviously, I'm there to help in any way I can, but I will not involve myself more in this unless there's anything I can do to help you. And likewise, I'm about to leave the meeting as soon as this item's over. I'm always there to help you with anything in the past, but I think what is terribly important is that a former chairman realizes that he is a former chairman and allows the present chairman a completely free hand to run it in the right way, as I know you will. This is my formal passing of the baton to you.
Thank you so much, Councillor Freeman. But I will cherish and value your experience and contribution, and I will take heartedly your offer to help.
Anytime I can help, but I will wait.
Thank you so much.
Thank
much
you
appreciated.
And very, very good luck with this incredibly important job.
Absolutely, absolutely. Thank you so much, Councillor Freeman. That's very kind of you. And thanks for presenting the paper and taking the questions. I have Christine Vigors. Please, can you come in with comment or question?
It's just a comment. I mean, yes. I was very much involved with some of the patient reference groups around palliative care.
Yes.
Last autumn. And there was, as we know, such a lot of feeling, and people who were involved in those groups were speaking about matters that were very difficult for them to speak about. So I do think that it'd be a great pity if nothing is done to follow up on this, and would like the committee just to keep it on the agenda, clearly not immediately, but to keep a watching brief on it.
Thank you, Christine. I think we all accept that. It's a very sensitive, very important issue, and anyone must have a dignified end of life, and I believe strongly in that. So I will keep it on my agenda. I will be setting up a working group when I discuss it fully with my members. I still really feel heartedly that this issue should never die away in the public, in the domain, seeking the appropriate support from NHS and CCG and the people who are at this stage in their life. They have every right from our community to have a dignified life, to end it, to be honest. But thank you so much. I can see the last question from Councillor Spalding, please.
Thank you, Chairman. It's just to say thank you to Robert and the officers for arranging those extra sessions of consultation. There was consultation over the hospices in North Kensington, but there was nothing in the centre of the borough. And I know the officers at very short notice organised a couple of extra ones, one in the Al Khatan Foundation in Earls Court and one in Baden-Powell House in South Kensington. But while I'm on, I just wanted to thank Robert as well, because Robert's chairmanship of Adult Social Care and Health has been an utter education to me. I found him to be the chairman who had the most expertise and the most dedication and the most intense hard work and attention to detail. And I think this committee and all previous Adult Social Care and Health committees owe a huge debt to Robert for his absolute attention to detail, for which I, for one, really sincerely thank him. Thank you, Robert. And I know everybody else joins me.
Malcolm, you
are
far too generous. And the will be arriving on your doorstep tomorrow morning to thank you. No, but seriously, thank you very much for all your support, and also for your chairmanship of the committee, which you chaired so well. It's a new era, and I very much appreciate the help and support that I got from the former members and the continuing members of this committee. It's so important, and I wish you all very good fortune in the future, and also to thank our lead member, who I think has always done the most fantastic job, particularly in this incredibly difficult time. She has worked tirelessly in order to in order to give the best possible health outcome to our residents, also to our officers, who have been, I think, simply amazing. Thank you all so much, and I will now leave you to get on with the rest of the meeting, and thank you again.
Thank you so much, Councillor Freeman. That's very kind of you. We'll continue the journey. It's a journey. We'll continue that journey together. Together, we'll win. Now, I conclude this item, and I move to the last item, A10, on the agenda. The next item is the Select Committee Work Program. That's including the work Grenfell recovery. There have been many challenges of the updating the overall current climate for this work program due to COVID-19. Some of our work has been suspended, unfortunately, which is set out any key observation, what's being concluded, and where we are going ahead next. NHS England is discussing a possible merger of the Brompton Trust with the Guy's and St Thomas Trust to reshape the provision of the cardiorespiratory care in London. There may be a need to establish a special purpose joint health overview and scrutiny committee to scrutinize the health implication of these proposals. I can update the scrutiny committee that we have initiated the contact with the NHS England, which we wrote to them, but we've never heard yet from them due there is the current director relocation. So what I would like to invite the select committee members to contribute topics for our work during the municipal year to 2021. Suggestion will include in the work program long lists currently being developed by the overview and scrutiny committee, and which will be agreed by councillors in September in 2020. So this is really a work in progress. And any question, any suggestions, because this really work program is critical for all of us to revisit the list currently in place, which has been discussed previously, and we need to come up with a list by September. So the work is not conclusive for tonight. What I'm asking tonight for members to consider is the paragraph 1.2 of the report for the recommendation. So if you have any comments, any questions. I have one hands up. Who's going to talk? Councillor Spalding?
No, sorry, Chairman. I forgot to remove my hand from last time.
I beg your pardon. Okay, then. Okay. Anyone wants to? Can I, Jackie? Would you like to just tell us your view now, the update on this issue, if you are available?
I am, Chair. the committee is developing its work programme, as you've outlined.
Yes.
So there's an opportunity tonight if anyone wants to put forward any topics, but also some of the other scrutiny chairs have emailed members after the meeting to ask for suggestions.
Yes.
So it isn't this only opportunity. There's going to be some consultation with residents or suggestion scheme. Residents can put things forward. That's about to be launched. So really, it's up to the committee to think about what they would like to do.
So what member of the committee think from this paper? I know the work program is going to be now work in progress between us from now until September. As Jackie highlighted, we just need to agree that's the topic to be included in the list for the already program being agreed, and to rethink about the postponed working groups. Maybe is it valid? Is it to continue, or it's up to you? So what members of the committee think on that? Any comment? Yes, I can see. Is there anyone? You see, when you put your Councillor Healy, yes, please. Sorry.
Chair, I
have to move it outside the committee now. This is we are absolute silence. So yes, Councillor Healy, please.
Sorry. Chair, I do think that there is a very much more urgent matter that needs to be discussed by the committee tonight, and that is the future of the Royal Brompton Hospital. The proposed merger is going to take place by Christmas, and there's only one more meeting of the select committee before then. I think that the council actually needs to take action now to try and stop this process. There is no proper consultation taking place. There is a takeover taking place, not a merger, without any public consultation, and this is quite without the rules. I think the council as a whole could even ask for a judicial review of what's happening, but there does need to be urgent action taken, because otherwise we will lose the Royal Brompton.
Okay. Yes. Anyone want to take?
Chair, if I may.
Yes, Councillor Jace.
Is it possible we can have a special meeting to discuss the Royal Brompton, because I think we just see in the documents today, and this has been ongoing. It's not something that just happened, and I think we need to really take it in a deeper way.
Yes,
it's not something we can just discuss in the last 5 minutes of this meeting.
Absolutely, I agree. I think we can have a special meeting maybe between now and this September on this specific topic. I will ask Jackie if this is feasible.
Yes.
I will recommend that.
Sorry, Councillor, I was just trying to unmute myself.
Yes.
Sorry, so just to give the background, this the changes at the Brompton have been discussed by the committee. In 2018, the NHS England came to the committee, and also the Brompton themselves, to answer questions from members. There was due to be a meeting with the chair of the committee, which at that time was Councillor Robert Freeman, in March of this year, but that was cancelled because of the lockdown. So you've written to NHS England to ask for clarification about what's happening. We did not receive a report. We haven't received a reply, so I would be happy to continue to work with you as chair of the committee to get some more information from NHS England about the plans to share with the committee, and then agree as councillors what the next steps would be. So I'm happy to meet with you as soon as you like, if that's helpful, to talk about that.
Yes, Councillor Healy, would that be
yes, I think that's helpful, but I think Jackie knows perfectly well that this is a really urgent matter. It cannot just be left.
Yes, yeah, because I wrote to the NHS England. We received the reply that the current director, she moved on into another area, and I will follow. I will work closely with Jackie and Councillor Addenbrook to find a way forward, so we can discuss it fully and protect the Royal Brompton Hospital. Yeah, definitely.
Chair, I think Councillor Rossi, sorry, you are there.
Sorry, Jackie.
I think Councillor Rossi, as Chair of Overview, would like to say something as well.
Yes, I've just heard her now. Councillor Rossi, please.
I just wondered, Jackie, whether it would be feasible to have a meeting. I mean, say the end of July. Would that be a possibility? And then we could have a special meeting of adult social care?
Yeah, if councillors want to have a meeting, they can have a meeting. And I think if we can get a response from NHS England about what the plans are, then it'll be the councillors of the committee can then decide when the best time for that meeting should be.
Makes sense. So that maybe we could get someone to come. I think Councillor Healy has a point. That time is pressing. So if it was feasible to have one at the end of the month with someone from, I don't know, the Brompton coming along to talk to us, then I think that might be helpful.
And I will work with the chair of the committee. I understand the urgency, and I'll work with the committee to see what the plans are and when the best time is for the committee to meet within those timescales. So I'll give full support, officer support, so the chair can work with the other councillors.
Thank you, Jackie, and I appreciate the support you gave me as well to initiate that letter requesting clarification from NHS England before we come to this committee. I really appreciate your support, which we acted promptly. So, but unfortunately, we did not have the satisfactory answer yet. But we'll follow up on that, as Councillor Rossi said. Yeah. All what I'm asking now the committee, please, is just to look at the recommendation 1.2 and agree to it, please, because this is basically what we discussed now, and to evaluate the current list of the work program, and if we have any other additional work program, any idea, topics, themes you want to pursue after we've done our consultation with our residents. That's all the agreeing in principle what we are going to do. So are you all in favor?
Yeah.
Committee members?
Yes.
All right. So I thank you so much. So we'll carry that recommendation forward, and I have no extra things to say on this paper.
Sorry, Chair, can I just interrupt?
Yes, you can.
Thank you. I just wondered if it would be possible to reinstate that JOSH meeting that was going to take place, because it could be held virtually, and I think it would be really important if that could go ahead.
Which meeting?
Sorry, again, meeting? Which meeting, Councillor Addenbrook?
The JOSH meeting, which was going to be with 40 other local authorities that Councillor Freeman had been urged to set up by NHSE.
Councillor, sorry, it's Jackie Hurd. Can I just clarify that?
Yes, please, Jackie.
NHS England have a statutory duty to consult with us if there's a variation in service. And because, as you all know, the variation is to a service that affects residents in many different boroughs because of the service being provided. They were suggesting to us that there would be a JOSC, as you've said, Councillor, and that we would convene it, but it didn't get beyond the suggestion stage. So I think that's something that that was one of the things that we did want to discuss with NHS England about whether that was going to be their proposed action. We just, it was definitely suggested, there was some background work, but it wasn't actually a definite thing that we were going to do, if that makes sense.
Okay.
All right. So there's a background work done on this, which we can look at. Yeah, so we can look at this work, Councillor Addenbrook, and we'll bring it to the committee in September. If it is, if it's okay.
Councillor, sorry, it's Jackie Hurd again, Scrutiny Manager. I will work with you over the next the committee said it's urgent, so if you feel this is urgent, I'll work with you over the next few days to try and get something from NHS England about what their intentions are. You, as the chair, I imagine would want to share that with your committee, and we can work out then when the best time for the meeting would be. When we get that information. I'll give you full support as the chair, as I said, to try and get that so you can work with your committee to decide how you want to progress it.
Thank you, Jackie. I think I got the signal. It's clear from Councillor Addenbrook. We should take it on. I will take your advice. We'll work together as from next week. Just give me the full background work to this one, and I will be guided by you how to take it forward. Thank you so much, Jackie. That's very kind. Any other comments, question on this? No? So there is no further action to be taken. So there is no other issue we need to take on. So may I conclude this meeting for the Adult Social Care and Health Select Committee? The meeting is ending 21:02. Thank you all for your contribution, and a very good night to all of you who contributed to this lively debate. And I wish you a safe and happy evening, and very good, very nice weekend. Thank you so much all.
Thank you, Chair.
Good night.
Good night.